other mobile factors on hearing thresholds in medical students of a tertiary care teaching hospital. And my guide is Dr. M. Lakshminarayana, Assistant Professor, Department of ENT. Coming to the introduction, mobile phones are the devices that uses electromagnetic radio frequency waves to transmit signals to mobile towers and vice versa. These radio frequencies, which are emitted by the mobile phones, are absorbed by the human body. This absorbed energy is indicated in the terms of specific absorption rate. Specific absorption rate, it is defined as the rate of energy that is actually absorbed by the unit of tissue and expressed in watts per kilogram. It is of two types, they are head SAR and body SAR. This SAR helps in evaluating the effect of electromagnetic radiation from the mobiles towards the users. And SAR of mobile phone ranges from 0.16 to 1.6, and the legal limit in India is 1.6 watt per kg. And worldwide there are about many users, around 5.6 billion users, and India it ranks second position. And the effects of radio frequency electromagnetic fields which are emitted by the mobile phone are sensation of burning or warmth around the ear, alteration of cognitive functions. And prolonged use of mobile phones lead to dizziness, headache, hearing loss, sleep disturbances. We all know that inner ear is a direct recipient of electromagnetic radiation, so it is a commonly affected organ. As only limited studies are there where there is interaction between the specific absorption rate and hearing thresholds. So with this background, we planned a study. So objectives of my study are to evaluate the hearing thresholds in the mobile phone users of medical students who are using mobile phone for greater than 1 year, and to correlate their hearing thresholds with specific absorption rate of the mobile phone which they are using. And it is an observational cross-sectional study which included 52 MBBS students, and we included the students who are using the mobile phone for greater than 1 year, and we excluded the students who are suffering from chronic diseases like chronic suppurative otitis media, acute suppurative otitis media, or who are using any toxic drugs, and who are using always had prior trauma. And this study was started after taking the permission from Institution Human Ethical Committee PES IMSA. And after taking the written informed consent from the students, a questionnaire was distributed among them which consists of various questions regarding their mobile usage, and they were requested to fill it, and specific absorption rate of the mobile phone which they are using were noted. And pure tone audiometry was done to all the subjects based upon the Carhad and Jagger technique with the help of Labet's audio lab meter. And air conduction, bone conduction was done, and their thresholds were noted. And all the individuals were classified according to the WHO classification of hearing loss. And we entered the statistical data into MS Excel 2010 and analyzed with the help of SPSS software. And we found for the to find the significant test, we used chi-square test, and where the p-value less than 0.05 was considered statistically significant. These are my results. Predominantly are males, and most of the subjects were using the mobile phones in the span of 2 to 4 years. And maximum duration of the call, around 50% of the subjects were greater than 30 minutes, and of 22 subjects out of 52 students were using the mobile phone for less than 1 year, less than 1 hour. And this is the range of mobile phones which were using, my subjects are using, which ranges from 0.16 to 1.60, and majority of the using from 0.90 to 1.19. These are the auditory symptoms, and in our study we found that 11 people are suffering from the sensory neural hearing loss out of total 52 subjects. And 0.90 to 1.19, there are 19 subjects where there we found that 4 people are sensory neural hearing loss. And in our study we found that 21% of the students have mild SNHL, but in a study which was conducted by Sahu et al. In Tamil Nadu, there is found that only 3% of hearing loss were there. Limitations, it is a smaller sample size, dual phone usage, and recall bias and social desirability bias by the response of the students. And about 52 medical students, 21% of the students has mild sensory neural hearing loss. Mobile phone users with higher SAR value was found to influence the hearing thresholds among the study subjects. 36.5% are using this range, and 54% of them had mild SNHL, but these are not statistically significant. My recommendations are limiting the usage, awareness regarding the electromagnetic radiations, periodical screening, and qualitative studies with higher sample size. These are my references, and thank you.
Why was the study conducted only for MBBS students, and the sample is also very too small?
No, sir. Generally, we thought to conduct in that, sir. However, many studies are there where it was conducted on many other patients. We want to see in MBBS students, sir.
Only in MBBS students. But what can be? The study sample is very too small, so that the statistics of the outcome also will not be that much encouraging or helpful.
Yes, sir. Why? Because
why could not have taken a general population?
However, many studies are there. So we want only very limited studies are there where it is evaluating on this medical students. Sir. So we want to do on this. Sir. Ma'am, it will be easy for our own people. They will come now, ma'am.
That's what your faculty only are telling. Apart from the students, your faculty also you could have included.
Yes.
Taking general population.
So this electromagnetic radiation, is it ionizing or non-ionizing?
Non-ionizing, sir.
So what is the non-ionizing radiation? What are the effects?
Yeah, coming to the here, there is maybe hearing loss and other sleep disturbances, altering of cognitive functions, sir.
Any physical effects?
Sir?
What are the physical effects? These are the you're telling ENT problems.
Yes.
In general, what are the physical properties of a non-ionizing radiation?
It may be causing hypertension, sir.
Because the physical properties of non-ionizing will itself cause the health problem, health hazards. Non-ionizing radiation. Non-ionizing. Non-ionizing radiation. Okay. Madam, yourself.
Your sample.
Yes, ma'am, but we calculated with the prevalence of 3%, ma'am. So we got that. But we'll
And in exclusion criteria, you said you have excluded students who were using Bluetooth or headphones,
that is what we took means. There are few people in our study who won't speak mobile with their with normal, ma'am. They will always use Bluetooth or earphones, ma'am. So we are excluded them, ma'am.
So why were they excluded?
Actually, from Bluetooth also there might be small amount of radiation which is coming, ma'am. For that purpose, we want to evaluate only this specific absorption rate of mobile phones, whether it is influencing or not. So we took only those people, ma'am.
Okay, and in the baseline evaluation, you checked whether any of them had sensory neural deafness or not. That was done for all. Because you concluded that some percentage developed sensory neural deafness in your study.
Yes, ma'am.
So in the baseline evaluation, did you rule out that none of the subjects were having that?
Yes, ma'am.
It was done?
Yes, ma'am.
Okay. And you said the SAR value is given on the phones.
Yes, ma'am.
So where it is given for our information, tell so that we can also have a look.
Yes, ma'am. Actually, this all information is given by Telecom Regulatory of India, ma'am. And for every mobile phone, we can see in the mobile phone box manufacturer there is head SAR and body SAR. And in majority of the mobile phones, when we type star hash 07 hash, it will come. It gives, ma'am, in majority of the phones.
Star hash 07 hash. Okay.
So, were there any side effects which you have noted in the history of the patients whom you have seen? I mean the sample.
Yes, ma'am. With the prolonged usage, they said that some of the people they are getting tinnitus, heat sensation, like that, ma'am.
Any history of ringing sounds always if they don't use the phone?
No, ma'am. That.
No such symptoms.
No, ma'am.
What about sleep?
Sleep, they said that okay, ma'am. Normal.
Sleep is okay.
Yes, ma'am.
But I could say there is a side effects of using this. They are not worried about the social manners and behavior, where they are.
Yes, ma'am.
They are in a bus, they are in a road, they are not worried what they talk, and they don't mind about when they hear the conversation, is it bad or good?
Yes, ma'am.
It's a social inconvenience.
Yes, ma'am.
So please do add this tag to your thesis so that it would reach people, start knowing what is behavior back again. Thank you. Your session was good.
Thank you, ma'am. Thank you all. Thank you, audience.
How did you make sure the sensory neural hearing loss is due to radiation and not due to continuous sound exposure from the phone?
We are... generally, it was where we are staying. There is no any kind of noise pollution or that. It is an environment eco-friendly area where we are living, and we are asked the students where we are took the subjects. Are there any exposure to continuous exposure to noise? Like in Hyderabad or something else, there will be continuous exposure to noise, no? So that we exclude.
My question is due to the noise from the phone. While they are talking, they get the sound, right?
Yes.
While they are talking on the phone, they get the sound.
Mm.
Why not the sensory neural loss is due to that sound, not due to the radiation?
But what my subjects, they said that they won't speak loudly, they will speak in a very small, means average, in a small frequency, that where we can, which is useful for conversation, that we took into consideration.
And I have one more question. Did you find which spectrum is more causing more sensory neural hearing loss? Is it 4G, 3G or 2G?
No, it is not coming to the, my study is not coming to the network. It is irrespective of the network. Whatever the type of network used, there will be specific absorption rate which is emitted by the mobile phones. That we took into consideration, not network.
Okay. You checked in the 2G phones. Right?
Yes, there is, for every phone there is specific absorption rate. When you are not using, for 2G phones also there is specific absorption rate which is printed on the box. So we took that one also into consideration. The network does not matter here.
Thank you.
And thank you. Thank you all.